and the commissioner is going to be kicking us off. So right over to you, Commissioner Choksi.
Thank you again, Dr. Morse. Really nice to see everyone this evening, and it's my privilege to welcome you to the New York City Health Department's Clinician Roundtable. I want to thank everyone so much for being here for this important conversation. And I wanted to start by saying we've made great strides in our historic vaccination campaign. We're approaching 9 million doses administered, 3/4 of all seniors in New York City with at least one dose of the vaccine, and almost at 2/3 of all adults with at least one dose of the vaccine. And all of this has been because of you and all of your steadfast efforts. And we are extraordinarily grateful for those. But among clinicians here on the call, we have to acknowledge that we still have work ahead of us as well. And that work is to ensure that the protection that vaccination affords extends as widely as possible. You've heard us say before that we have striven to place equity at the center of our vaccination campaign since the very beginning. But with New York City reopening, we have to redouble our efforts to reach the people and the places that are yet to be vaccinated. And let me just speak very clearly, particularly our fellow New Yorkers who identify as Black and Latinx. Like many of you, I'm sure I feel a deep sense of urgency about this, particularly given what our communities of color have experienced over the last 18 months. All of the suffering and grief that has been wrought because of this pandemic. And in terms of this next phase of our vaccination campaign, I also think about the nature of the work, which I know from taking care of my own patients requires iterative conversations, as well as an all hands on deck approach. And of course, that's where all of you come in. And it's also where the focus of this seminar, the Use Every Opportunity tool, comes in as well. We're grateful to have developed this with our partners at the Greater New York Hospital Association. And when we set about creating it, our goal was very simple. It was to help healthcare partners strategize on how to engage patients regarding the vaccine at each touch point during their visit at your clinic, your hospital, or your facility. Now, I think the tool is very valuable, and I hope that you'll find it valuable too. But we wanted to focus tonight about hearing specific stories and examples about how to use it and how we can each get better in taking on this shared and urgent priority. The way that I think about it is that COVID vaccination is perhaps the single most important preventive intervention of 2021. And so it is certainly worthy of our time and our effort. So with that, let's dive right in, and I'll turn it back to you, Dr. Morse, with a bit of an introduction, although people likely already know who you are. But for those that don't, Dr. Michelle Morse serves as our Chief Medical Officer, as well as Deputy Commissioner of the Center for Health Equity and Community Wellness. So back over to you, Michelle, and I'm really looking forward to this session with all of you.
Thank you so much, Commissioner Choksi. It's, again, just an honor for all of us, I think, to be in conversation together. And as clinicians, as healers, as folks who are also leading the operations of getting the vaccine available, accessible, I think, again, it's just a really important opportunity for us to convene, share our practices, share stories, share successes, problem solve, and engage together. So I'd like to also welcome everyone. We know that we've invited team members from across hospitals, health systems, independent practices, chief medical officers, chief nursing officers, vaccine operational leaders, team members, FQHCs, and beyond. We want to thank you for your service. Again, and really appreciate your partnership and recognize how much you've put forth over the past year and a half. We also want to acknowledge that we're really in many ways, kind of the last mile of our vaccination campaign. This is the phase where, the challenges are manyfold, and increased attention, increased effort, increased collaboration, and partnership and information sharing is even more important as we just try to chip away again at what is a historic vaccination campaign, and again, appreciate all of your partnership and work in it. And we think that this phase of the campaign is also incredibly important when it comes to partnering with healthcare delivery systems. And many of you represent those, and that's a huge part of what we are hoping to do through this Use Every Opportunity checklist and tool and conversation this evening. I'd like to bring in my colleague here at the Health Department, Dr. Celia Quinn, who has been an incredible leader in the vaccination and COVID response. She's the Executive Director of the Bureau of Healthcare Systems Readiness here at the Health Department.
Thank you, Dr. Morrison. Thank you, Commissioner, for your welcome. Also want to echo the welcome to all of the participants today. Your work in this space is really critical to our success as a city moving forward. I want to echo the urgency that we feel with starting to use more and more of our healthcare delivery system to help people choose to become vaccinated and to make sure that they can become vaccinated. To that end, that's why we have developed this Use Every Opportunity campaign, again, with partnership from our colleagues at the Greater New York Hospital Association and others. The intent of this tool is really to support you and your work to bring vaccine to your patients and to your communities. We have really had to shift our approach from using a mass vaccination approach when we had limited resources. Now that we have plenty of vaccine resources, we need to start shifting our thinking to bringing this vaccine into all of the healthcare delivery system spaces that we can. And I think it's important to think about using opportunities, not just for administering vaccine, although we definitely want to encourage that in as many spaces as possible, but also thinking about all of the many opportunities when patients interact with the healthcare system to help them think about the COVID vaccine and how important it can be for themselves, for their families, and for their communities. We also are using this Use Every Opportunity campaign to continue to expand our health equity approach toward vaccination. This is something that our health department really sees as everyone's responsibility in New York City. It's not up to one institution or agency, one hospital system, or even provider. We all have to be working together, thinking about how to make sure that this vaccine can be distributed and have equitable uptake throughout our city. That's really the way that we will help everyone see the benefits of the COVID vaccine and help our city emerge from the pandemic. So for today's event, what we are hoping to do is to raise awareness about what has worked for providers in our city to start implementing the Use Every Opportunity campaign and the tactics that are outlined in that checklist. Hear about some success stories about vaccination in various settings within the healthcare delivery system in different kinds of spaces, and really talk through some opportunities to expand the use of this checklist and make sure that we are all using every opportunity to help every New Yorker become vaccinated. I think I'll turn it back to Dr. Morse to introduce our other panelists.
Thanks again, Dr. Quinn. And I am just honored to get to introduce Lara Alves, an incredible health system leader here in New York City. Lara hails from the Health and Hospital System, and Health and Hospitals has been an incredible champion and partner in this campaign to us at the Health Department already. Lara is the Associate Executive Director of Ambulatory Care at Bellevue in the Health and Hospital System. She oversees the outpatient services as well as the COVID-19 testing and vaccine operations at the Bellevue site. Throughout the pandemic, Lara has been leading many of the efforts around transferring patients out of 11 hospitals to open up capacity at H&H in the hotel program. And Lara returned to Bellevue in her new ambulatory care role in November 2020, just in time for the vaccination campaign rollout. I'm going to ask that the next slide be shown. And Lara is going to be speaking specifically to domain 1 in the Use Every Opportunity checklist, which is around leadership commitment and accountability. And I also just want to preview that these 6 domains in the checklist are all interconnected. And so it's even though we list them as 6 different domains, they're all connected. And our panelists' comments today are going to touch on each of the 6 domains. both success stories, and again, during the Q&A, we'll be able to delve more into some of the opportunities in each of these 6. So over to you, Lara.
Thank you for the very kind introduction, Dr. Morse. Good evening, everyone. Hope you're all doing well. So I'm going to touch on primarily domain number 1, but I'll certainly touch on number 6 as well, just given that I represent ambulatory care. So as the vaccine operations lead at Bellevue, I wanted to share how I think leadership commitment and support have been so key to the success of our vaccine operations, not only here at Bellevue, but I think at H&H at large, including now, of course, the focus on the use of every opportunity, especially in the outpatient care setting. So let me begin with the leadership component. So at the system level, we've been lucky to have had Dr. Wallach, who's actually also on this panel right now. He's our H&H AmCare Chief Medical Officer, and Dr. Thiebert, who's our senior leader overseeing pharmacy operations and everything vaccine supply related. So very early on, Dr. Wallach and Dr. Thiebert implemented these weekly calls and meetings. And at these meetings, we have not only the vaccine site leads like myself, but also pharmacy, IT, and finance leadership on the calls, where we go over major changes in guidelines, vaccine operation guidance, pertinent updates, as things have been and continue to be changing very fast. And I think, a lot of my counterparts across the system will probably echo this, the transparent communication, the real-time information sharing, creating this forum so that we can discuss our challenges, so that Dr. Wallach and Dr. Thiebert can provide the support and solutions as necessary and sharing best practices. I think that's been very crucial to the success of our vaccine program here at H&H. From my perspective, it's been the perfect balance, if you may, of receiving the right amount of information and support from the leadership in central office, but at the same time allowing the vaccine sites just enough wiggle room to implement things and to pivot as needed. The CEOs of the hospitals, of course, were all very aligned with the efforts and goals and lended the support locally. I can say here at Bellevue, our CEO, Mr. Bill Hicks, has been tremendously supportive of me and my team throughout this entire vaccine journey. And of course, on the ground level, I then transmit all this leadership and support onto the staff members who work day in and day out to get vaccines into arms. So to me, the question really is, what results do we get from this type of leadership and support? I think for one, it certainly allows us to implement the vaccine pods very uniformly and very quickly across all of our sites at H&H. We receive very strong support for everything from supplies to outreach efforts to our patients, right, to schedule the appointments. And I think because of the leadership support and guidance that we received, we were able to implement processes very efficiently. For instance, for our outpatients who are already here on site for their clinic appointments to either get the Pfizer vaccine or the J&J, depending on their preference. Similarly, for staff, where they also now have the option of receiving either the Pfizer or the Johnson & Johnson. So my main takeaway is that with the leadership support and the right expertise that we had at the table all along the way, we were able to achieve very efficiently the ability to maximize the different pathways to vaccinate and really capitalizing on all the opportunities possible within our four walls.
Thank you so much for sharing that, Lara. And it's a gargantuan task, especially in a system as big as H&H's. But really, really, again, thankful for your efforts. And we look forward to delving into some more of the stories and experiences of success in H&H during the Q&A. Next up, we have our second panelist, Dr. Daniel Rosa. Dr. Rosa is going to be talking about domain number 2 in the Use Every Opportunity checklist, which is the provider and staff education domain. Dr. Rosa is an internal medicine and emergency medicine physician who's also board certified in addiction medicine. Dr. Rosa is the senior medical director at the Acacia Network, which is a network of primary care and behavioral health institutions, and is one of the largest Hispanic-led health organizations in the country. Dr. Rosa was born and raised in the South Bronx and has been serving there as a clinician for I believe over 2 decades. If I don't want to age you, Dr. Rosa, 1 decade. Okay, sorry about that. Great. And we're really honored to hear about Dr. Rosa's efforts in the Acacia Network for primary care and behavioral health providers, engaging those providers and educating the staff in the Acacia Network about vaccination. Thanks so much, Dr. Rosa. Over to you.
Thank you, Dr. Morris. That very, very, very nice introduction, and I appreciate that, of course. The fact is that yeah, I've been here for 1 decade. Initially, it started out as me coming on. I was born and raised in this very neighborhood, as it turns out, in the South Bronx, and I came in because I wanted to serve back to my community. I figured that I was an emergency physician for over 20 years. But I decided to come back, and it's become a sort of a mission for me, simply being in this particular type of environment in which we serve so much of the African American and Latinx population and communities of color. And it didn't surprise me at all that because many of our providers actually and front end staff and staff in general here actually are from the community. So we had even anticipated, and that was actually the first part of actually getting engaged in getting vaccinations, even right at the onset. We were very, very fortunate that most of our FQACs, all of our FQACs, were eligible to get vaccinations very, very soon. In December, we had ample amounts of the Moderna vaccine to actually start providing vaccinations pretty much for the entire staff. We of course, just like everyone else, we started prioritizing the most vulnerable. And of course, me being an emergency physician, I was fortunate enough on day 1 to have received the Pfizer vaccine. I thought that part of it was actually very, very important, and it actually allowed me to engage the staff as to what we anticipated would be sort of like the hesitancy that we were going to anticipate, given that in the past we've had much in the way of hesitancy when it comes to other vaccines before the COVID vaccine was available. Basically, mistrust is one of the first things that we were going to anticipate that we were going to come across, and of course that also reflected in the staff and even the providers. So the first thing that I made clear to was that we needed to be transparent as far as just informing what was the mechanism of action, because a lot of the folks, even providers, were wondering, well, if you're going to inject us with the very agent that's going to cause disease, aren't you going to get us sick initially? So it was a process of educating, of speaking about the mechanism of the mRNA and the vector viruses that we've been utilizing since they've been approved. And the second challenge, of course, was after the transparency part, is to engage them and to what it is that we were going to try to do, because it would be disingenuous to offer a vaccine that you were not comfortable in getting yourself. And then the third part of it was to engage them in sort of like, it's not necessarily just you that's being protected, but by protecting yourself, you're also protecting others. So sort of like broadening out the scope of what it is to get vaccinated, to get protected. So not just protecting yourself, but protecting others. And we anticipated that there were going to be obstacles and barriers along the way, but we basically kept at it. And we approach it, being that I'm a Hispanic and I speak several languages. There's a language barrier that goes into it. The access, we were trying to basically make it known to people that access was one of the biggest barriers, which wasn't going to be something that was going to be indefinite, that we would quickly be able to get the vaccine out. But as far as the providers and the staff was concerned, it took some doing, but it was just basically a matter of education. of basically appealing to their cultural and their ethnic part of it. And not only that, but to basically engage them as far as trusting that I was the first one to get it at this facility because as an emergency physician, I was offered it on day one. But basically, that was basically how we went about it. We would have bi-monthly Zoom meetings with providers and staff to discuss these things in both languages, in Spanish and English. And that went a long way also. So it's actually bringing the message across, and more people, more and more of the staff, and certainly I think 100% of our providers at multiple sites. Finally, after 3 or 4 months, at this point, I would say that at least 90% of us have been vaccinated with one of the vaccines that have been offered. So we've been very successful in educating and bringing those whatever concerns into those biweeklies, and we were also basically reaching out to the community as well. The vulnerable in Spanish and in English. I gave multiple. They're all over the YouTube somewhere. So basically, that's the best that I can say. I'm actually a replacement for my chief medical officer, Dr. Collmore, who was supposed to basically do this, and at the last minute pulled me in. But I'm very happy to have engaged in this talk as well. Thank you.
Thank you so much, Dr. Rosa, and I really appreciate your pinch hitting, but I think you did a great job explaining how important your outreach and education to not just all of the providers within your clinic system, but really all of the staff, making sure that people understand how the vaccines work, how important they are for themselves and for the patients and for their communities. These are really critical pieces of making sure that when patients have interactions in our healthcare delivery system, they're interactions that help move them towards choosing to become vaccinated and accessing the vaccine. So thanks for your contribution. I think it is my pleasure and privilege to introduce our next panelist, which is Dr. Jane Zucker from the Health Department. She is the Assistant Commissioner for the Bureau of Immunizations. I don't want to guess how many years she has been at the Health Department, but I will say that it is impossible to imagine this vaccine campaign without Dr. Zucker's leadership. And I will ask her now to talk a little bit about the importance of using our electronic medical records to support the Use Every Opportunity campaign.
Thank you very much for the introduction, and it's my pleasure to be part of the panel. And I want to just thank all the participants. You know, all of the achievements have really been due to all of your hard work, you know, at the facility level and getting your patients vaccinated. So just a big thank you for accepting all that vaccine that we've been sending out. What I want to address in my remarks about the electronic medical records is just how important the issue around data is and the immunization data for your patients. And we can only be more successful if we actually could measure how well we're doing with coverage, if we actually know what proportion of our patients in a facility have actually been vaccinated. And we know we can take a playbook from flu vaccination, from childhood immunization, that what you measure, you can actually then put in place the quality assurance programs that you need to actually increase your coverage and to identify where you may be hitting roadblocks, whether it's performance in a particular department, or having to change your strategies or tactics to improve vaccination within a particular part of the facility. And I think when we also talk about the immunization data, it's really very foundational to the next 3 domains that we'll talk about, because you need to know who has been vaccinated, and you also need to know who has not been vaccinated. So when we, just to talk about the EMR, so part of that checklist really talks about what are very, again, I think very fundamental sort of processes in terms of EMR prompts. You've all used them for flu vaccine, and so it's critical that those prompts are there for COVID vaccination as well. And it's also important that they remain there until someone is vaccinated. What, some feedback that I've gotten, we've heard with other vaccines that someone may, it's not just the offering of vaccine where people will, they may say, okay, we've offered, and so we've sort of met what the prompt may ask us to do, but it's also that idea of using every opportunity for conversations, because patients may in fact not agree to be vaccinated on a particular, the first time you have a conversation, but the ongoing conversation and education and interaction with their provider is really critical for them to perhaps change their mind and then later accept vaccine. And I think the other important key about the EMRs is just talking about the data in the citywide immunization registry and how CIR and the EMRs interact. With so many vaccines given, right, most of the vaccines were given outside of your facility, right? So in order for you to be able to measure coverage to know who's been vaccinated, getting that data from the CIR into your EMR is really very critical. And again, you will need that for coverage. And so we do have, I would say, fairly good reporting of all the immunizations. There's been, lots of vaccines given, whether it's been in our vaccine hubs, in the large vaccination clinics, in the pharmacies. And so, you can get that data into the EMR really two different ways. For smaller facilities, it may be possible to sort of look up individual patients and then enter the data into the registry. It's important that if you don't have the documentation that we have from the vaccination cards, that historical information also get entered into the registry. But I think one of the great successes of the vaccination program has actually been that we've been able to increase the number of facilities that are actually reporting directly from their EMR into the registry. And this is again what's happening on the back end. So the provider who's actually seeing a patient, in an exam room may not know what's happening behind the scenes, but really we have over 3,300 facilities just reporting data in electronically. And almost 3/4 of those are actually bi-directional communication. And that's important for you all because that's data that, again, with clicks of a button in your EMR, you can actually query a patient in the registry and bring that data back into your EMR. So it populates the EMR. And you really will need this information if you're going to talk about vaccination, whether it's prior to discharge, in outpatient settings, and in the emergency department. And so I think that there's also the educational component around CIR and EMRs, because I think the pediatric care community is very familiar with using CIR and all of these tools, but not as much with the adult care community. And I think that's just another place for education so that you get the information you need, again, to measure vaccination coverage in your facility, have benchmarks so you know where you're going in terms of coverage, and then you can implement the strategies to get there. So I will, I think, end my remarks there, and then we can have more discussion. Actually, I'm going to say just one more thing. We actually do have tools in the registry that for you to look at COVID vaccine coverage reports for your facility, so you can actually get ready lists of patients with first doses that were given at your facility, as well as who hasn't gotten a second dose, because that's another sort of focus of using every opportunity is to make sure that we get people a complete vaccination series. And we can talk about that more in the Q&A. And I'll end there. Thank you very much.
Thank you so much, Dr. Zucker. I think sometimes it can be easy to underestimate how important the data is. And if anything has showed us the importance of data, it's COVID and this vaccination campaign. If we needed to learn that lesson again, we have. So thanks again, Dr. Zucker, for those comments. I'm going to be I'm going to be very brief, but I'm going to speak a little bit about vaccine being offered to all eligible inpatients prior to discharge, which is domain 4 in our use every opportunity checklist. And just as a reminder, we did copy and paste the link to the electronic version of the tool, the Use Every Opportunity tool in the chat. So that's available to you all. We hope that you will both use it yourselves and share it with your teams at your clinics, at your hospitals, at your in your health systems. And again, hope that you'll be able to use this tool as often as possible. For vaccination being offered to all eligible inpatients prior to discharge, we recognize this is a profound challenge. The logistics of inpatient care obviously are already challenging. And during the times of COVID, especially over the winter when occupancy rates were much, much higher than they are now, we recognize also that many of you who work on inpatient services and many of you who lead hospitals and health systems were trying your best to try to find a way to make the vaccine available for folks who are hospitalized. These are folks who tend to be vulnerable already. They tend to be disproportionately people of color. They tend to be, of course, disproportionately people with chronic diseases and at risk of getting COVID. These tend to be our most vulnerable people. And of course, they also tend to be our elders. So these are the people, this is our target audience, right, for the vaccine, and making it available on discharge was one of the many ways that many of you were trying to both increase the vaccination rates as quickly as possible and make it as easy and accessible as possible for our patients and our communities. And so the story I just wanted to share really briefly was actually one of the first experiences I had when I moved to New York City, was rounding on the inpatient internal medicine wards at Kings County Hospital. And I was both, honored, of course, to get to serve in that way and continue to be thankful for Kings County and for the service it provides in Brooklyn, but also amazed at the fact that on my first shift at Kings County, I was in the position of discharging a patient, and the resident said, "Oh, we have to make sure, we have to page the nurse coordinator who can make sure that this patient gets vaccinated if they're willing prior to being discharged." And for many of you who work on the inpatient services, you probably know, right? Discharge today is kind of in quotes, right? It might actually be tomorrow, it might be the day after, but as soon as discharge is in the conversation, what the residents were doing at Kings County was paging a particular nurse who was coordinating vaccination on discharge, and if the patient consented, and they batched the patients together. Again, at that time, a lot more restrictions around a wastage of doses, a lot more restrictions around who could receive a dose of the vaccine, but patients were being discharged, being vaccinated on discharge, and it was just really powerful for me to be able to see that was an accessible and available option to patients on leaving Kings County Hospital. And now, as many of you know, especially those of you that are involved in vaccine operations at your hospitals and health systems, there is a lot less restriction around, or a lot less reporting, and a lot more flexibility around wastage of doses of the vaccine. And that was a critical piece of making the vaccine more available to patients on discharge as well. So that's all I wanted to share about the vaccine being offered to eligible inpatients prior to discharge. And I'll pass it over to Dr. Quinn for domain number 5.
Thank you, Dr. Morse. Yes. Even more challenging than the offering of the vaccine on inpatient discharge, we're also really encouraging all of our hospitals and health systems to try to work toward offering the COVID vaccine to all eligible emergency department discharges. Reaching patients in the emergency department is a really critical opportunity for reaching some of our most difficult to reach populations. These are patients who may have very few other interactions with the healthcare delivery system, and who might also have difficulty accessing the vaccine at some of the other types of vaccine sites that are available to them. So in order to get this done, it really needs particular attention to make the emergency department a location where patients can access COVID vaccine as part of a visit, where again, it might be their only opportunity. The tool that we have shared at the link in the chat really highlight some of the elements that can be considered to make a program like this successful. Like Lara highlighted at the beginning of this panel, it really requires a champion to advance the project, to develop the workflows, to coordinate the activities across the different teams that are going to need to be involved, including pharmacy, nursing, and your clinical staff. Important things to consider are how to assess, like Dr. Zucker mentioned, assess the vaccination status of every patient at the time of triage, so that you can identify those patients who might still need to be vaccinated. And then it really requires thinking through those workflows to allow the necessary observation time after the vaccine is administered, without disrupting the overall capacity of your emergency department. We'd also want people to think about how to offer vaccination to any individual who's eligible that is accompanying the patient. So they might not be a patient in the emergency department, but if it's still possible to offer that person a vaccine, it's really worth taking that opportunity to at least talk to them about vaccination and see if you can get them vaccinated on that visit. And lastly, relating back to Dr. Rosa's remarks earlier in this panel, it's important to make sure that all of the staff that working in the emergency department are trained on these workflows and understand the importance of bringing this into every shift. So I think there's some other tips within the tool that I really encourage people to think through. Again, this is a process that may not be easy to implement in every emergency department, but even if those conversations can be had with every patient at every visit, as you work toward being able to offer vaccine at those visits, I think it can make an important difference in our ability to vaccinate all New Yorkers. I think I will turn it back to you, Dr. Morse.
Thank you. Beautiful. So we're down to our kind of final minutes here. And before we open it up for Q&A, just want to remind everybody that the Q&A box obviously is on the right-hand side in the bottom here. And even though you can't unmute yourselves and ask your questions out loud, please do start to type questions into the chat on the bottom right in the WebEx screen. If you have questions for our panelists, if you have questions about the 6 domains, if you have questions for the commissioner, anything, welcome. So please do start to put your questions into the chat here. And as our final story about the 6th domain in the Use Every Opportunity tool, we're actually going to show a video. And I'm just going to introduce the video before we show it. The video is of Sabrina Parker, who is an outreach representative in our public health detailing program here in the New York City Health Department. And I was actually detailing with Sabrina last week. She is incredible and an absolute gem at the health department. She's been detailing for 6 years and has just amazing experience being able to really support providers in independent practices and ambulatory care settings and in clinics across the city around various campaigns that the health department has done. And she has been detailing ambulatory care practices for the past several weeks as a part of our campaign to really, again, support providers in being able to have the conversation with patients about the vaccine, recommend it, and then actually be supported with various tools in how to have that conversation. So I think we're going to show the video of Sabrina Parker. For some reason, I'm not hearing the sound. Is anyone else hearing it?
Hi, my name is Sabrina Parker. I'm an outreach representative with the Public Health Detailing Program at the New York City Department of Health and Mental Hygiene. We are conducting a vaccine confidence and access campaign where we come into the community to assist primary care providers and other healthcare professionals to increase the rate of fully vaccinated adults. Right now I'm in Brownsville, Brooklyn, and the rate is 31%. So I'm working with this site behind me. Today, we encourage our providers to use every opportunity framework. So making sure that at every clinical encounter that they ask the patient if they're vaccinated and to make sure that they have a plan before they leave that office and make sure to get vaccinated, to make sure that when they answer questions that patients might have, that they're honest, that they're empathetic, acknowledge any fears or concerns that patients might have. And, providers will tell us that, like bi-directional communication, that, there are a lot of patients who are still very fearful They don't trust government. They're not, fully on board of how fast the vaccine was developed. So, they still have some questions and concerns. So providers will say, sometimes what they think is best is just letting patients know that they've taken the vaccine and that, it helps build confidence. Sometimes it'll change the tide, it'll sort of open up the conversation, and sometimes patients are a little bit more willing. Also, when we bring evidence-based best practices, patient and provider education resources, that will motivate patients. So today I'm bringing some palm cards, and it's in English and Spanish. And this is a resource that the site had asked for because sometimes they say when patients see things in their language, they're more motivated to read it, to, take it home, to sort of, come back with questions and just help foster that conversation. So we understand that, in the community, there are a lot of health concerns, comorbidity. So, providers are really challenged trying to make sure patients, take the vaccine to prevent any further health concerns. And also, they know social determinants of health is an issue. So whether it's like housing issues, food access to healthcare, these are some of the challenges that the providers are, dealing with. So we're just out here to help. Hopefully, we'll get more people vaccinated today. Thank you. Bye-bye.
Great. Hopefully everyone was able to see Sabrina in action and hear a little bit about her detailing work. Some of you may have actually had Sabrina visit you, who knows? So I would love to turn it over to Dr. Quinn for the Q&A. And I see there's a question in the Q&A already. I'm also just going to remind everybody here to go ahead and put your questions in the chat or in the Q&A function in the WebEx platform, and we will do our best to try to support your questions and answers.
Great. So I see the question in the chat from Dr. Rosa. What has been the response or buy-in for offering the vaccine prior to discharge from the emergency department? And I think as an emergency department doctor, you may be picking up on the fact that this is a very challenging thing to do operationally in some of our emergency departments. So we have been talking with emergency department leadership across the city about this for several months now, and really just emphasizing the need to think through and plan so that we're able to do it safely and effectively. And again, like I mentioned, I think part of it is even if hospitals can start with a few of the items on the checklist in each of the domains, so even if it's assessing for vaccination status on triage and advising patients that they should become vaccinated, even if they're not able to be vaccinated at that moment, I think those are really important first steps. I don't know if there are people among the participants who have experiences that they might want to also share. You could type them into the chat. Or Dr. Morse, if you have other things that you wanted to add on this question.
Yeah, no, I think, I'm in the dark. It's a great question. And appreciate Dr. Rosa putting it forward. I also want to just invite Dr. Andrew Wallach, who's also here with us and has been a great partner to us in the health department on this particular tool. Welcome, Dr. Wallach. Just in case you want to add anything, Dr. Wallach is the ambulatory care chief and chief medical officer in the H&H Office of Ambulatory Care. So we may not have anything to say about the emergency department specifically, but just also want to call out that Dr. Wallach is here and that H&H has been a great partner in championing this tool. Looks like Dr. Zucker, you might have something to add.
Yeah, I'll just say that a lot, and I think this goes for the inpatients prior to discharge, a lot of, so it applies for both, right, on the inpatient and the ED side, is just that one of the big obstacles that we had consistently heard was around the wastage guidance and needing to use all the doses in a particular vial, whether it's 6 in Pfizer vial or if you're using the Janssen vaccine. But I think that's, I think the change in the wastage guidance is really critical to being able to achieve, vaccination in this setting. And we still are getting pushback. It's just such a change in just what all the guidance beforehand about, no wastage, but just to remember that what we really want is to take every opportunity. And if it means opening a vial for one patient in the ED and you don't know if you're going to be able to use a full vial, that we want you to do that. And whether, same thing in the ambulatory care setting as well, as on the inpatient side.
Thank you, Dr. Morse. This is Andrew Wallach from H&H, and happy to be here. And I would just, amplify what Dr. Zucker just shared, is that I think we need to meet patients where they are, whether that's in ambulatory care, the inpatient service, or the ED. I can tell you at H&H throughout our system, we are offering the vaccine and both discharge from the inpatient service as well as ambulatory care visits, and are about to go live in the EDs. However, we have heard anecdotally, Dr. Rosa, from our providers in the ED, the patients are asking for it and they'd be willing to take it. And so we're going to actually dedicate a nurse in each of our EDs to literally go around and speak with each of the patients who are there for other reasons, who are going to be treated and released, and offer them that vaccine at the time of discharge. So we're really excited. And I think the message is be flexible and really try to capture patients however and wherever they touch our system.
I can so appreciate that. Simply, I work in the emergency department at the Philadelphia VA, but it's interesting because and it just absolutely is exciting to me because of the fact that now, and that's why I said about the buy-in, and I wasn't just speaking in terms of patient buy-in. I'm talking about I was also speaking in terms of provider buy-in, because ER doctors, myself included, of course, we expect to very quickly deal with a situation and make a disposition very quickly as possible, and get on to the next patient. And this is just a mindset, and of course it's a reality also. But so that when it comes to vaccinating somebody, and sometimes just like Dr. Morse mentioned, this is the only opportunity sometimes that you get to actually engage with certain people, especially those who have housing insecurities, food insecurities, and have substance use and mental health issues. And this the one time or the several times that they come into the emergency department might be the only opportunity to engage with those particular individuals. So for me, it's a very exciting possibility to basically not just for all of our FQHCs in the ambulatory setting, but in the emergency department, to increase the population. That's and when you speak about a vulnerable population, we certainly are speaking about those with the housing insecurities and the mental health, who don't have stable lives and chaotic lives in and by themselves. So thanks a lot for that. Yeah, that's very interesting.
Beautiful. We're getting some great questions in the chat and in the Q&A. I'm going to read one of them. Dr. Zucker started to address this one, but I'm wondering, Dr. Zucker, if you can take this one. We are administering vaccines consistently, but it seems like we have less patients coming in compared to when they became available. What is the current regulation on administration of a single dose for a patient that walks in and wasting 9 others? This is from Laslan Moshayev. Dr. Zucker, would you be willing to take that one?
Yes, with pleasure. If you have one patient, open that vial and vaccinate them if they're walking in. And if it means wasting the other 9 doses in a Moderna vial, so be it. But, we've protected one more person. So I think that that's really critical. Remember, you do have some hours on the vial. So for, the 6 hours on the Moderna, so you may have another patient walk in an hour later, 2 hours later, or, and be able to, use some of that, that vaccine. But I think it definitely is a change in the mindset from early on, but we really want to use every opportunity. So thank you for that question.
Beautiful. Thanks so much. I see 2 more questions. I'm going to throw this one out to anyone who's willing. What approach are you using to follow up for the second dose if Pfizer is given in the emergency department?
So I can start on that. At New York City Health and Hospitals, both on the inpatient as well as the ED, we are using the Johnson & Johnson Janssen product, which, as everyone knows, is a 1 dose. However, if a patient has a strong preference for the Pfizer vaccine and they're seen in the ED, we will expedite their vaccination by sending them to our vaccine hub at the facility upon release from the emergency department. And there, at that point, they will be scheduled for their second dose 21 days afterwards.
And Dr. Wallach, I'll just add that on the New York City Vaccine Finder, people can identify locations that are using the Pfizer vaccine, and they're accepting patients who were vaccinated at other locations for their second dose. So that's another important piece, that patients can get the second dose elsewhere.
Beautiful. Another question, I'm not sure if anyone feels comfortable answering this one. I'm not sure what the answer is myself. Is there the possibility of offering incentives for young people that are available at the city health department and H&H sites to others who are receiving the vaccine at non-city health department and H&H sites? Hard one.
I also do not know the answer to that one, but I think that's one that we can bring back to the City Health Department and the Vaccine Command Center.
Beautiful. And then another one here, there have been reports of some sites requiring IDs before young people are given vaccines to confirm their ages, even if their medical records are accessible at the same site. Is this true, and can this be avoided?
So maybe I'll take this one and get started, and Dr. Wallach, feel free to jump in. So if their age is documented in the EMR, that's fine. And then for minors, there's a couple ways that we're validating their age, which includes actually verbal attestation from parents. And at that point, we do not require an ID.
That's exactly right. And I think worth really emphasizing that latter point. Thank you, Lara, that you made, that New York State DOH clearly delineates that if a parent accompanies a minor, the parent can self-attest to their child's age, and that is acceptable for vaccination. Beautiful.
If you have any other questions, of course, please feel free to put them in the chat or in the Q&A. These are really phenomenal questions. I'm not seeing an unanswered one yet, so I'm going to pose one to the panelists. And unless another one comes in, this may be kind of our last round. I might ask each panelist actually to weigh in on this question as kind of a final lightning round of responses and final word. And the question here is, very, very simple and straightforward. What strategies are you implementing in the sites that are located in your sites that are located in low vaccine neighborhoods? So if each panelist, if you are able to talk a little bit, or not every panelist may have something to say on this one, but share kind of what your equity approach is around vaccination.
All right, then maybe again, Dr. Wallach, I'll start, and then you can add on. So I think across many H&H sites where we have been and continue to do a lot of community outreach activities, encouraging folks to get vaccinated in our neighborhoods. So I know here at Bellevue, we've partnered with some of the residence buildings around the area. We've partnered with ACS, which is right next door to us. I think serving the populations in these neighborhoods has been and is a big part of H&H's mission, right? And we have been serving these populations. So just a mere outreach to our patients to get vaccinated, I think that alone is trying to reach that goal, right? And I know very recently H&H, we've deployed these mobile vans, which I now see almost every morning when I'm stuck on the LIE in traffic. And these vans, are out in the communities in these neighborhoods offering COVID-19 vaccine. I don't know, Dr. Wallach, if you have anything else to add.
Yeah, first, I just want to thank you, Dr. Morris, for asking this question, because it is so important, right? We certainly have seen throughout the pandemic, certain groups who have been disproportionately affected. And for us at New York City Health and Hospitals, that tends to be most of the patient population that we provide care for. So it's something we've been very attuned to. Agree with everything that Lara said, and would just add very briefly that we're doing active outreach to our patients, okay? And so it's not just enough to say, hey, we have a vaccine hub, come and get one, but we're doing active outreach electronically through our electronic health record portal. We're making phone calls. We're having providers speak to their patients, which is so critical for them to answer questions. And then we've created an ambassador program, or vaccine champs, where individuals can actually ask questions one-on-one with somebody who has the answers. And it's not just doctors, it's all levels of staff. which I think is really critical. We've created a training program for them, and folks can literally come in. And I have to use an example that our environmental services staff had lower rates of vaccination throughout our enterprise. And it's something that we noticed in tracking who we're giving vaccines to. So we actually did a special session just for that particular department. And afterwards at Bellevue Hospital alone, correct me if I'm wrong, Laura, but we had 60 members of that department after that session who came in and got vaccinated, who were not willing to do so before. So again, I think it's really important to do that messaging one-on-one, use multiple pronged approach, and be willing to make sure that folks have that opportunity to ask questions.
Yes, I couldn't agree more. As a matter of fact, with Dr. Wallach, in fact, Dr. Quinn, it's been a remarkable undertaking, getting as far as we have at this point, and it's going to prove to be an undertaking also to reach those who have the vaccine hesitancy. The nonprofit that I am basically the senior medical director for is the largest provider, nonprofit provider of homeless services, and we also are now that that we don't have to absolutely Zoom with everything. We're actually going out in person with the outreach to a lot of the and offering free rides and actually incentives also. We haven't decided what those incentives are, but we're actually going almost door to door as far as the homeless services are concerned that we serve, and to have those few individuals and the new arrivals, of course. Especially now that the mayor is actually making some changes and returning a good portion of some folks that were living in other facilities back to shelters. It's important to engage as much as possible with those new arrivals to make sure that we have them on the radar and to offer anything that's necessary to get them to basically protect themselves and others.
Very powerful. Thank you for that. Just the two final questions in our last minute here. Unless Dr. Zucker, of course, feel free to jump in if you have something burning to say. But I see a question about just using waiting rooms and other spaces to increase messaging to patients. I've seen many practices who are doing that. We actually, on the health department's YouTube website, you can find tons more videos than you ever wanted about the vaccine in every language you can imagine. Would encourage all of you to consider using those videos in waiting areas, etc. And then there is a question around increasing vaccination amongst healthcare workers, and Dr. Rosa spoke a little bit to that their rate is about 90% at the Acacia Network, and I know H&H also just recently launched another component of their vaccination campaign for staff at H&H. I don't know if you all want to speak about that as well, just in this final moment of the roundtable.
Sure, happy to take that, Dr. Morse. And so very briefly, we are moving forward with what's called an opt-out process for a vaccination, whereby any of our staff who have not yet received a COVID-19 vaccine will be automatically scheduled with a date and time for their vaccine. They will receive notification of this, and they'll have the opportunity to accept, which we hope they all will, or they can reschedule to a time that's more convenient for them. Or if they decline to get the vaccination at that moment, we're asking, for them to tell us kind of why they're not accepting, so we have a better understanding of how to then in the future further target to get them. So it's called an opt-out system, where we go ahead and schedule them automatically. And there's been some literature to show that if you do that, you get individuals who were kind of on the fence to go ahead and say, okay, yes, I will come in and take the vaccine. So we're really looking forward and happy to come back and share our results.
Thank you so much. Yes, more dialogue for sure. And again, appreciate H&H championing this tool, and also Dr. Rosa sharing your experiences. I want to just close us out. And I'm sorry we didn't get to this last question for incentives for youth in detention. It is a good one. I think incentives are going to continue to be a huge part of the conversation going forward. But we want to thank all of the panelists. I want to thank Dr. Quinn, my co-host. I want to thank Dr. Rosa, Lara Alves, Dr. Zucker, Dr. Wallach for jumping in as well into the fun. And I want to also really thank our coordination team, Ali and Adriana and Charles. We really appreciate your support. And thanks to all of you who attended. We really appreciate you joining. We are going to send a follow-up email that has the link to the recording as well as the link to the tool, the Use Every Opportunity tool, which we also put in the chat. And we, again, just appreciate all of you for the hard work that you're doing, leading the vaccination campaign in every space that you're in, and encourage you to continue to use every opportunity as much as possible, everywhere you go, any space you're in, offer the vaccine. And thanks again for joining, and until the next time, bye-bye.